remembering and logging in on time. Time we spent some time looking at some introductory and the background of psychotherapy in Nigeria. And today, Dr. Abiola is also going to do an introduction to counseling and psychoeducation. One of the things that irritates me the most is seeing my residents after when in the management they say I'll psychoeducate the patient. Sometimes the patient is unconscious. Sometimes the patient is so psychotic, and I keep wondering. And I ask them, "What are you psychoeducating the patient for?" They say, oh, "Sorry, the relations." And it's always so. I'm hoping that maybe we should really open up the general things to even the residents so that they would learn a few things. So today we're going to have a formal introduction into counseling and psychoeducation. It's not psychotherapy, but it's the least any doctor, any health worker can do. Whether you're an orderly in the ward, a social worker, a nurse, whatever, every worker in the place should be able to do that. So would ask Abiola to do us some introductory thing to it. Then I'm hoping that during the discussion today and the subsequent discussion that will go on during the week, many of us would be able to come to terms and understand what psychoeducation is all about. Dr. Abiola, you have the floor.
Thank you very much, sir. Uh, Thank you, Prof, once again. Good morning, Prof. Good morning, everyone. And good day to all of us, wherever we are. Uh, as we said, this should just be an introductory lecture or discussion session about what counseling and psychoeducation is. But it has been tag one because hopefully we will look first at counseling, then at another session we will look at psychoeducation. This is because they are all also vast in their way. And without doing that, we'll just do a shabby look at it, and that may not convey the content. So we'll be looking on the first aspect of it today, that's counseling. And hopefully, in this session, we hope to provide a foundational understanding of some counseling theories, hoping that that will help to equip us with evidence-based skills for addressing mental health issues in diverse Nigeria contexts, and to emphasize the ethics and our cultural awareness and attuneness to the counseling practice. Uh, Generally, counseling is defined as a professional relationship that empowers whether the individuals, the family, or group of people to help them address something that may be personal, that may be social or emotional in nature. And the primary focus is to enhance the well-being. That's one of the definitions. The other expand the spectrum of what the well-being should look like, and be used either to accomplish a mental health improvement, a wellness purpose for educational purpose, or to meet some career goals. That's the American Counseling Association. So the primary thing, as the definition of counseling, is that it is a collaboratory process where the counselor utilizes evidence-based methods to assist clients in achieving their identified goals. So the focus is on facilitating self-discovery, problem solving, personal growth, and this will be taking place in a supportive and confidential environment. And this is what most of us practice in our uh, clinical encounter. So it will not be that far from it, but the emphasis needs to be there so that we can make sure we create that supportive and confidential environment when we want to carry out counseling, and like for all the other talking interventions. What distinguishes counseling from other helping professions is that when we look at it, counseling and psychiatry, that of course we know psychiatrists usually make diagnosis, they treat mental illness using various approaches. Medication is mainly used, but some also have many other skills. So they can also use counseling, and they can use psychotherapy, use other somatic treatment in order to help somebody to be healed. But it may not be all that may have this talking therapy aspect, and it's good to see that we base the emphasis upon that. And that is why it is said that the counselor, who might be the psychiatrist himself or the non-psychiatrist, It might be a social worker, it might be a clinical psychologist, or it might be a counseling psychologist. So it might be even any other professional who is trained in this. That the primary focus is on how to implement psychosocial intervention and not to prescribe medication. Counseling is also different from social works because not all social workers, most social workers don't have the counseling skills. So it's different from there. And that's why for social worker, their focus is to address the broader societal issues. And they are there to also advocate for clients within the system. While the counselors will primarily focus on individuals or group therapeutic intervention to help them solve other personal or social, emotional issues that the individual may have. Well, also, counseling is different from psychotherapy. Often, we typically use them interchangeably, but this is wrong in the sense that the focus of counseling is looking at the periphery, the surface issues, to deal with surface, whether mental health issue, social issues, personal issues, educational issues. It will look at the surface issue. But when we want to look at the depth issue, when we are not looking just to look at the symptom to address symptoms, we are looking at the depth, deep-seated psychological issues, then psychotherapy will come. And that is why the training may appear similar to most people, but it is the depth that makes the difference. So for a psychotherapist to be trained, he will learn the depth of the evidence base, while the counselor will learn the superficial or the periphery of the evidence base in order to be able to do this. So in essence, one cannot be either of the two without having evidence-based background or understanding. From this, we'll go briefly to what are the goals of counseling. And like I've said, because they are not for deeply seated challenges, that's why they will be very useful in helping to reduce symptoms. They help to increase our self-awareness. They will help to teach us some skills to develop in order to solve some problem, to cope effectively. And it can also be used to help us foster our own growth, personal growth, where we can have a better understanding of ourselves. We can grow our resilience, learn how to do stress management very well. And from resilience, we can improve our wellness, and that is well being. And we can also use it to help bring about some behavioral change by promoting more healthier behaviors. So, all these are some of the goals of counseling. They are bigger than this, but they are more than this. And counseling can also be the goal for maybe a manager in the place in order for the individual to be able to manage well. So the goal of counseling is far wider than what might have been listed there. And for us to lay a foundation for it so that we can say that are there evidence based for counseling? Yes, there are. And that is why I'm trying to give some of the major theoretical approaches to counseling. uh, if you look at it here, the first that's listed is called the person-centered therapy, and this is where the humanistic school are, the positive psychology, psychiatric movements are, and here they promote to help the individual. If you remember the Maslow hierarchy of needs, it helps us to be able to see that from the Maslow hierarchy of needs, we want to help the individual to move beyond the basic physiological needs to that level of self actualization. In order so that because without helping the individual to have that capacity, it will be challenging for the individual to be able to help him or herself to heal the extra psychic challenges that the person is facing. We're not talking of the extra psychic problems now. The extra psychic challenges the person is facing at, at that level, it will be challenging for that person to be able to do that. So that is why having some understanding of what this person-centered theory is about and giving some of that, and one of them is how the therapeutic relationship is, which is they are the group, one of the schools in in psychology, one of such groups that help us to be able to. Sorry, someone. Sorry, let me omit the person. Okay. Okay. Like I'm saying that it is the person-centered approach that provide one of such things, which is dictum to most talking therapy. And it teaches us what we call the unconditional positive self-regard, where it's one of those dictum that for one to be a good talking therapy, a good talking, either a counselor or a therapist, the individual needs to be non-judgmental. They brought that idea because they teach us how to be give somebody an unconditional positive regard. They also emphasize empathy and genuineness to facilitate the growth and self-discovery of the individual. Another theory that lies there is the cognitive behavioral theory. Because for the depth of it, it helps us to be able to understand that the dictum is whatever happened to us make us to think, and the way we think will make us to feel in certain ways, and what we feel seems to add fuel and the impetus, the energy that make us to behave or not to behave in certain ways. So based on this dictum, by understanding this, that the individual should be able to apply this to be able to understand how illness is formed, that is the maladaptive thinking pattern, how maladaptive behaviors are formed, and that is why they can be amenable, and that is why they can be amenable to change using this cognitive behavioral approach. And that is why they do have some roles in teaching some of the symptoms, the surface symptoms of anxiety disorder, depression, and other some other specific problem. They do contribute to that. Another as one that I will be talking that may be new to most of us is the solution focused brief therapy. This is one of the very short therapy. It can range from 1 to 6 or maximum of 12. And this is one of those therapy that emphasize about the concept of hope, and it's able to use this to be able to help individual to be able to understand that okay, I need to understand what hope is. I need to be able to appreciate what hope is, and I'll be able to ignite it in myself and do some other skills in order to be able to enhance this in myself or with other people in order to be able to get over the challenge. And they usually use concepts, one of those like called the miracle question. So, and the miracle question, they are simple, but there can be many ways to ask it. It's about how to explore what the hope of the individual is, how to improve or able the individual to challenge that yes, the individual can still be hopeful and be able to do things about that. So the miracle questions do play some role there. And they have those questions are also done in such a way that from there one cannot scale it up to move forward in that. And most people might prefer it, but the training is deep and the people on this may, if they learn the surface, they can do some therapy on that, but they may need to learn the deep in order to be able to do the therapy of it. One of the world that's most popular to all of us are the psychodynamic group, and one of their most two theories that are usually used in most counseling will be the psychosexual and the psychosocial. We'll look at the psychosocial more rather than the psychosexual, but the psychosexual is taught by everybody, looking at the five stage of the psychosexual development from Sigmund Freud, and I believing that that's how everybody move from that infancy period, from that child, the neonate period, up to when the individual will be currently. So that is how it is looked at, and that is how it flows there. But the psychosocial brought by Eric Erikson will be a very good tool for an aspiring counselor to be able to have a depth understanding of this, because this will go a long way for the individual to be able to see more other practical things to do, so that people being in front of them might not look as if finding it difficult or not to be able due to challenges of psychologization, due to challenges of psychologization that may find it difficult to understand what the psychosexual approach is talking. When the psychosexual will be talking that okay, everybody's born with drives, which are the drive to live and the drive to that, the eros and the thanatos. And based on that, as those conflicts, then they bring about those conflicts that occur in each psychosexual stages. And when people get stagnated, what happened to them? People might still find challenges with it, especially when we look at our cultural background in Nigeria. But when we look at the psychosocial, then that may have more value, more role to play, looking at our cultural background. And others that we may look at may be to look at the stages of grief, because loss is a phenomenon in life and in general. And based on that understanding of that phenomenon, then we'll be able to do a lot to be once you understand what it is this theory is, and we can be able to apply it to help people who are going through, who are mourning, to be able to go through it and overcome this. So we will try to look at some of those theory. This slide is crowded, but I hope that I'll be able to introduce us to the Eric Erikson stages. Eric Erikson worked with his wife Johan to develop the eight stages, even though it is named after Eric Erikson. But after his death, the wife was, well, of course, would live longer, would died in her late 90s, was able to develop and go. What happened after 65 years plus age, where we now look at the elderly stage, where we have the middle, and the late elderly phase. She was able to work out, and that is one of the things that this is one of such theory that when we have an understanding of it, it helps us to be able to understand issues right from birth to the elderly, where people live longer in this age. Because in that time, when Erica Dixon died, the average lifespan usually at around that less than 60. So that's why his theory stopped there. But now that people live longer and the wife live longer, that she was able to develop more. So I'm looking at that. We have the trust and mistrust, and the Erikson psychosexual and Johan's theory, the psychosocial development, is also from the psychoanalytic, I mean the psychodynamic school of thought. Eric Erikson is a student of Anna Freud and some other prominent uh, psychoanalysts. And from this theory, and since this slide will be shared, it helps us to be able to understand that for people who are there in the first 18 months of life, that the issue they may have is about trust. And when this is done the right way, they get to have a secured and trusting relationship. That is the aspect of bonding. The bonding works for them. But when that is, then the negative outcomes come for them. They have fear, they have anxiety, they can be the one that may have the suspicious nature almost throughout life. So, and getting stuck in this stage, it can be the trouble. For the second phase, from that 18 months of life to 3 years, that when people were able to have good autonomy, they are able to develop confidence and be able to start building their independence in life. But when this is not achieved, shame, self doubt, redundancy, and I mean they always have this not willingness and what you may describe in personality that they are close minded. They are not open to experience. They are the conservatives. So this might have happened at that age. And the next phase to look at will be to look at the initiative versus guilt, and to look at that from 3 years to 5 years, that when people have a good outcome, then they start building that sense of purpose, and they learn what it means to be a leader and to be a good follower. They learn this and be able to play a team there, so their agreeableness is being built gradually. When people does not get this, then there's challenges. They carry a lot of guilt. They are afraid of punishment, and that may be the reason they do things. They cannot bring purpose to why they should do that. And reluctance to take initiative is part of what is common among them. And that may be what moves some people up to now. The next phase, which are living those much earlier aspect of childhood, uh, coming to uh, the other phase to the early teen years, the 5 to 13 years. And that is where people are trying to look about their confidence in their skills and ability to do something, and their willingness to see that, oh, I would like to do this more. Uh, Please, Oga Kingsley, maybe you should be on your end. You can restart and rejoin. Thank you. Uh, so that, and that confidence in their skills and ability do play a great role for them to develop more. Whereas when we look at the negative outcomes, they have the inferiority complex, and they felt that they're incompetent, they're inadequate. And that is why it's look at that when you ask somebody to do things before the age in their first decade of life, when their industriality grows, they want to do it well. So they just go ahead and do it. They don't, they just say, when should I do it? They go ahead and do it because they want to impress. They want to show that, yes, I'm becoming responsible. But after that phase, when the individual come from the early teens to the late teens to early adulthood, the individual start asking the question, whom I am. That's where identity and role confusion might come in. And a good sense of identity and direction can be formed by that individual at this age. When somebody could not be able to form, the confusion about the person's role and the place in society comes, and the people must start having more challenges there. And this might also relate why people are battling with this issue, that substance related problem might come and other things. Anxiety challenges might pop up more there because of that confusion that they go through. The next phase is intimacy versus isolation. And this is usually in the second decade to almost the third decade of life. And that is why in this case, people want to form a loving relationship. People may want to settle down. They want to look for their dream life partner. But then when people don't realize that happily ever after might be a myth, that it's good to aspire for that. But when that doesn't come, they end up to form good, fulfilling relationship. And they felt lonely. Despite being in a relationship, they felt lonely. Despite being married or being a partner, they are still lonely. They felt isolated. And there is the fear for them to keep on the commitment which they've made. But when the people understand that it needs more work, more deep, more depth, more moving forward, then they find that, oh, I need to do more, and then their relationship can start taking shape and having more meaning. Then beyond that, where generativity and stagnation comes in. At that age, people are already working, and then they're trying to question themselves: Am I having any value to the world? Am I contributing to the world? And this is very important because at this stage, it might determine how the individual work, how the individual uh, what is driving the individual to continue to do the work that the person is doing. So this is very important. And when this is not there, people may just get stagnated. They don't understand why they are working. They go to work every day, but it's with a lot of frustration. They don't have that internal motivation to do what they are doing, and that becomes very problematic for them. What Eric Erikson stages are the eighth stage, versus integrity, the ego integrity versus despair. Why the Eric Erikson stage stopped there? Why the Eric Erikson stage stopped there? Uh, it's about where people are usually in retirement, and now they started facing more trouble. That if I really my contribution that I'm trying to make, is it having any impact? Is it contributing anything to them? When they couldn't find this, that yes, I've developed this, I've designed that, I've been an innovator for this, but yeah, they couldn't see the impact of what they've done. They might be seeing, reading other relatedness to it, that though this is not adding to what I hope to have achieved. This is not bringing the outcome I hope to do. Then despair can come in. But yeah, when people live beyond this age and they get more to their early elderly period, and that is where the gerotranscendent comes in. And this is one of the stage that can help us to see that for people who be seeing this psychogeriatric age group, then this is one of the things that we can help them to see, because what they will be battling with there will be to reflect deeply on their lives and the meaning of their existence. And in this stage, when people were able to reflect better on this, they'll be able to focus more on spirituality. They have acceptance of their mortality. They no longer see themselves as immortal. They're able to appreciate the shift in priority, and the integration of life experience become helpful. And that is where usually people at the big data, they have what to offer when somebody have a positive outcome in this, and they help to channel and shape focus and direction for the next generation. And you can see the relationship between grandparents and their grandchildren. And this usually and they may be able to provide that focus. But when that is not the case, despair and disgust comes in, and that is full with a lot of regret, bitterness, and dissatisfaction with life. And that may also have impact in what they contribute to life, because they are afraid of their mortality, and that makes them to find it difficult. And depression often can settle in, and that's why depression maybe is the second leading mental health challenge that they usually face. Or maybe if not of all the problems in the elderly phase of life. So this is why I just try to take emphasis on this. The other theory that which is under the others would be to look at the Kubler-Ross. And we know Kubler-Ross stages talk about grief, and it tells us that grief is in 5 stages. But his colleague, which is David Kessler, improved it further because after Kubler-Ross died, and the 5 stages were very helpful when somebody is going through grief. The denial, the anger, the bargaining, the depression, the acceptance. But even when people accept what is happening, the meaning they brought to it is very important. And if you cannot help somebody to explore the meaning of that loss that happened to them, then there will be negative outcome for them most of the time. And the failure is that they will find it difficult to make find a reason. They'll find it difficult to understand that their ego is not just about feeling the positive, but their ego, the ego defense that is epidemic, is about feeling the positive and the negative. And without that, they will not be able to enjoy the good aspect of what has happened. They will only be looking at the negative part of it, and that will be the negative outcome. But when people have better meaning from it, it does brought a difference because it allows them to grow, and that's why post-traumatic growth usually come from it because of that sense of purpose they're able to get from it. And typically, I've also tried to give us how these each stages look like in our NOAs in Nigeria. I won't go through that because these slides will be shared later. I will implore us to look at it subsequently. But the slides do tell us about how it might look like in the Nigerian context. The next is that what's the importance of this theoretical framework I've told us? And the importance of this, a strong theoretical provide the following. It gives us a structure and guidance in what we are trying to apply, and that is to give psychotherapy. Because without that, then we might be lost in what we are trying to offer. So it's very good that we have that. So and without having a map, an idea of what we are going to do, and a basis to understand the problem that an individual is bringing to us, then it might be difficult for us to counsel them. We at the best we might just be giving them advice and will not be able to provide the counseling for them. It also gives us conceptual clarity where we can understand, okay, this is why this person is having this problem, because you can make diagnosis. We can make the different diagnoses that people can make. We can be able to have that. We can understand, okay, this is why this individual is feeling sad. This is why this individual is feeling lonely. It gives this theoretical foundation help us to have that understanding of what it is like. And it also helps us to understand that whatever we do is based on an ethical foundation, because whatever decision we make, we should work within the ethics of what it is, and we'll look briefly about ethics towards the end. And it can help us to also evaluate what is the outcome, because the theory gives us how the illness comes to be or how the surface problem is about, and it will also be the one that will help us to know when somebody has gotten well. It also gives us that clarity and help us to move forward there. But one of the things that is there often missing in most people when we look at this theory, because they are mainly from the Euro American perspective, is that we find it difficult to make them to be culturally validated in our context, and that is due to our own creativity. So it's very important that as we look at this, we look at our own creativity to see that we don't swerve away from what those theories are, but we'll be able to apply it in the cultural values that we have in the context of our country. So to do counseling, you can look at it that it's in stages. Usually, counseling is looked at to have 3 stages: the initial phase, the middle phase, and the termination phase. And each of the phases do carry activities and what is expected. The first phase is usually to see how to build rapport, give the person a sense that where you are is safe, because this is where you can trust, where your secrets are safe. And that's why those all the ethics are there, that is confidential, and whatever is said there remains here. This is a house of secret. We are not going to take this out of here. We are not going to make use it to make jest of anybody. I will not be discussing it on the corridor, not with our family members, that, okay, after work today, this is what has happened. Let's talk about, no, because these are people's pains, these are people's suffering. These are not the way to honor that. And that's why the initial phase helps us to go through all this in order to be able to appreciate it. The middle phase, it is where the core work of trying to change an individual. But with the rapport, the individual started feeling well because somebody cares for them in the initial phase, and all the trust relationship shows that yes, care is being given. But in the middle phase, the person will do more to be able to apply the interventions that will be brought based on those theories, and that will help the individual to be able to go on. And most of the work will be done in the middle phase. And in the termination stage, it will involve how to help the individual to see that, oh, what we have done is this, we are making a review of it, we have achieved our goals, and the counseling will end, so that you can keep on going to live your independent life, not to be dependent on the counselor. The individual can move on. Typically, the average counseling session should be, a formal counseling should be about 8 sessions, but it can range from 1 to 20, and the at least 30 minutes should be spent per session. The counseling process, the counseling process goes so many ways. There's another slide that is not in this. I hope we will see subsequently, and that contains the to show us that each phase is what is expected that we do. And so for the phase one, it can be one session or to maximum of 6 sessions, depending on the heaviness of the surface problem we are looking at. So that means, so not only to make rapport, not only to talk about boundaries, but to set the goals, how goals should be set, what are the things that are essential in goal setting. All that will be taken into consideration and look into in trying to do this. So the initial assessment, when we are trying to do that initial assessment, it helps us to see that, oh, that we should take history and look at the background and some of the method we use to that we all have experience of what doing clinical clerkship is in our various callings. And ability to do psychometry is also very important. The clinical psychologists might have an advantage on this because their primary job is to do psychometry, and they'll be able to do this to be able to know whether there is a challenge or not, there's a disorder or not, or there are surface problem that the individual needs to treat or otherwise. So that will take care of that. Another thing to look at is also to look apart from psychometry, to be able to get collateral information, and that is where in the context of where we practice, family are a good source to look at, or significant other in the person's life, because all this contributes to what we are doing and be able to bring the value out for the individual. Maybe in maybe if not in the context of Nigeria, maybe other places, because they are individualistic society, that may not. But in our collectivist society, collateral information are very vital, and the participation in helping the counseling process at some point might also be very worthy to bring about it. One of the things that is very essential we should do is to learn how to do risk assessment, because it's very important for us to know who is violent, who is suicidal, who is likely to harm himself or others. So all these are very important. Those are some of the things under the risk assessment. And these are not the focus of what I'm about. These are things that are essential. And for somebody to be a counselor, he needs to go through supervision, so that when he's dealing with a patient and is under supervision, the supervisor will help the individual to be able to navigate all these aspects that is expected for the individual to go through. So the therapeutic relationship is also one of those very vital aspects of doing psychotherapy. I mean, of doing counseling. And but for all talking cure, therapeutic relationship is very vital. It has become as one of the common factor to all form of therapy, of to all form of talking cure. And because it's very vital, how it is carried on, how it is coordinated, who does it are very vital. Otherwise, it's going to lead to a failure. So rapport is part of the therapeutic relationship. Ability to give empathy is part of it, to understand and share the client's feeling, to be able to give what the humanistic psychology call the unconditional positive regard is very vital. Be able to show genuineness and be sensitive to the culture of the individual, the religious belief or the non-religious belief of the individual. They are very vital because they provide the quality of the relationship. And once this is well motivated, well carried out, the motivation for the patient to engage, to see this not as just a pastime or a waste of time, but to see it as something they needs to engage with and be able to get and take responsibility for what is taking place in the process is vital, and it will show. Look, like I was saying, that this slide it will later be shown is to show us what each initial phase is like, usually from 1 to less than 6 sessions. What are the things we look at? The focus will be on our intake assessment, our history taking, setting goals for the therapy. The middle phase is where the intervention will be, where we have to give a lot of emotional support and validation, and we have to build the skills. And the termination phase is where we win off and terminate the individual from the distance, that will let the individual know, will make a recap of what has happened and what it, at times some people will be able to know when we are planning, because at the termination phase where you also plan the relapse prevention for the individual, and also planning that, most likely this individual based on this might not have been able to adequately, based on life challenges and other factors that we might have seen from our initial assessment, our intake session. You'll be able to see that, oh, this individual will need some some booster sessions, and they will plan it as part of it. So it's not just follow up, but a follow up with some uh, counseling plan ahead for it and what to do about it. It's very vital, because without that, it's going to make the trouble of what the counseling process is about. Okay. Having said all that, I've said that the counseling, because it's generic in its own this thing, there are basic skills that one needs to develop. Apart from telling us all that, and those theories are there, but all those theories contribute to these basic skills that are unique, that are shared by all talking therapy, because their supervision and their depth aspect, but this the periphery of it, because they are shared by all of them. This is why it's worth talking and looking at these basic counseling skills. Briefly, is to look at them. The attending, that's usually where we'll try to be, or presence in the person, and be able to be physically and emotionally available for the person. And one of the very important thing about attending is to do practice active listening. Most of us learn to speak, but we have lost our ability to listen. And active listening is very vital if I want to be a good talking therapist or a talking counselor. But whatever talking care we are providing, active listening is very vital part of it, and it's very essential. And maintaining eye contact is also culturally dependent, and this may change based on culture and values of the individual. I must be able to understand what the body language might need. At times, you might even need to practice and to show the individual for them to know. Another very good skills that one needs to learn is reflecting and paraphrasing. And this we need, that we need to restate what the person has said. We need to uh, tell it the way the person said, restate it in our own way. That's paraphrasing it, to be sure. The sorry, please. My apology for that.
Are you sure we should not take a minute so that you can drink some water and we can go on? Maybe we should take a break, a minute or so that our lecturer can
Thank you, sir.
take a seat.
I think I might continue because of time.
No, no, it's not because of time. Take some water. Let's do a minute or so.
Okay,
When you
sir.
can drink, then we can continue. It's
Thank you.
better to lose time than to lose more than time.
Thank you, sir.
All right.
Uh, Thank you, everyone. I'm very grateful for your concern. I really appreciate it. Thank you, sir. Thank you, ma'am. Uh, with the permission of Prof, I would like to continue.
Yeah, continue.
Thank you, sir. So, I'm at the reflecting, paraphrasing, where we carry out reflection, and this is very vital aspect of what we need to do, because without having that ability, we might assume that we understand what the client is saying to us or what the patient is saying, but our assumption might be wrong. But because what you might think the meaning of what the person is saying might not be what the person. So it's very good for us to reflect on it by restating it, paraphrasing it, and summarizing it. That okay, this is what aspect you are talking. Is that what you are saying? Say okay, then yes, well, that's what I mean. Okay, or can we say it this way? Is it the same thing that it means? Oh yes, that's the meaning of it, and that will summarize it, and that way we are understanding one another, and the message is being passed. So that's reflection and paraphrasing. Another core skill that should take place should be silence, and silence is to use pauses effectively to give the client time to reflect. Uh, like I said, silence is also part of active listening, because when we do active listening, we are looking and we are doing it in a thunder level, caring way. And apart from doing that, we are also engaging the client so that the person know this person that is silent. It's not that it's wandering away or is doing something else. It's actually taking what I'm saying seriously. So it's part of the active listening skills that is very essential that we should have. Summarizing, I've tried to discuss that. And rapport building is part of what our active listening will also help us. Our initial engagement will help us to build the rapport. But rapport continues throughout the phases of the counseling. Because it continues there, our empathy must also continue to be extra and be appreciated throughout the counseling process. So it does not only at the beginning that we do rapport, we ensure that the rapport continues to be built on across the entire counseling process. Then there are questions that we may ask, and how to ask questions are very important. And I want to believe the next slide might show us about that. And these are very vital aspects of what we need to do. How we can ask questions to the client, what format do we do? And I'm sure these are not known to most of us that are here. But without carry out question the right way, then getting the right information might be difficult. And we can also that cannot encourage without that we will not be able to help the individual to reflect deep. And that is true contemplation. Because question can help the person to look deep inward and look, oh, this is something that is there that I fail to see, though I did not interpret the right way. So questioning can help in that way. Immediacy is to be able to bring everything to the here and now, and that is one of the value of doing counseling. It's not usually about the past. The past might cause the problem, but when we are here and now, we have to do it, and we have to be able to look at what it is doing to now, and that's why it looks at the periphery, those peripheral issues that are affecting the individual now, and not looking at the core, not looking at those back or historical thing, but it's looking at, oh, it has impeded this person in this, it has affected the performance of this person here, it has prevented the person from getting this job at so it tries to look at that, and immediacy is very vital in looking at this, and be able to help the client to concentrate on specific issues, and that is focusing. Because without that, the client can wander away, the client can do circumstantiality and can get lost. So it's good to be able, as it's going down, we take those mention of that and be able to bring back, okay, let's focus on this, let's explore this, then move to the other issues that are there. These are some of the basic skills. So they are called the core counseling skills. They have their ways in Nigeria, in the sense that attending our cultural context is to see that eye contact with elders can be looked as a sign of disrespect. So we should be careful about this. In the Nigerian context, when you're looking at reflecting and paraphrasing, and it's also can be a challenge in that, because the other might look, are you saying you don't under are you saying that I don't understand what I've told you? So one need to be uh, very skillful in how we bring that forward to the an elderly individual who might not understand the technique we are practicing. And when we summarize, we should be sensitive, not just to make it casual. That is this not what you are saying? No, we should say it in an empathic way, so that they in the Nigerian culture that appreciate that respect for as part of it, be able to value and flow with it, and be able to say, yes, this person speak my language, and be able to carry it along. This rapport building is also very important. And in our this thing, the title that people call themselves with are very vital, because without that, it might be difficult to build rapport. The person you just call this person is pompous, is rude, so I don't even need to voice to tell what is on my mind. I say, "Hey, whatever you want to say, keep talking. After all, you like to take over the talk, and we may not." So building rapport might not get it right if we don't appreciate what the culture is there, that will address people the title they have, and will be able to carry it through the process of the doing the counseling. When we question too, we should do it in a respectful way, for not forgetting that in the Nigerian context, I will ask questions to the elderly. The nuance is there different from our peers or to a younger person. But irrespective of the people we are trying to bring to ask question about, we should do it in such a respectful way that will make them to feel that, oh, I'm valued, and yes, so I can engage in this. In the immediacy also, is that the sensitivity we bring to it should be non-confrontational. There are some times we may practice confrontation, but in some contexts it should be non-confrontational, because this will go a long way to help us to see that we can address the issue that is here now. Because when this become confrontational, the client might switch off, and the other cultural issue might come. So is it because I'm sick that you can talk to me like this, that you can do this? So that can be challenging and the way to be done. So that's why collaboration is very vital, and the tone that we use is very important when we are trying to make practicing immediacy. And the same thing with focusing. So thank you. Some of these skills I've talked about, I've tried to just pick some of them. The active listening entails that we should be able to look at the body language of the person, whether the eye contact or posture, what it means to them or not. Verbal affirmation are very important. Okay. It's important to take note of them and when they are being used, to see whether it's to corroborate what we say or it's to express some deep seated or some peripheral suffering they are going through. Or even if it's just to do it in a sarcastic way, we need to be watchful and be able to see that, and to be able to reflect the context and emotion of what is happening. So active listening helps us to do that. In terms of carry out empathy, I've tried to do that. One of the things that most people may not see is that empathy is due to have three types: the cognitive empathy, the emotional, and the mixture of the two. The cognitive empathy is what most of us try to do, and that's why the people can see beyond our surface empathy and say, no, he doesn't care. He just tried to scope me. So, and that's cognitive empathy. And that may be similar to what the psychopath may have, because psychopath can feign that they feel for people, and people can see that, he's just pretending. He does not meant it. The emotional empathy is where the individual can feel that, oh, this individual can actually float with me. He's trying to put himself in my own shoe and trying to feel what I'm trying to express it the way. So the individual can be able to appreciate it that way. When we practice the two together, it adds more value to and help us to be able to be effective in carry out empathy. Or otherwise, we'll do it and the individual will not be able to feel, will not feel comfortable with us, and that can affect our rapport and other aspects of the therapy. Our questioning skills that we know is we started with open-ended question, with close, we then move to closed-ended question to express some specific thing. We can clarify whatever we're asking about. Those are very vital. And those are the role to play, because all these are not going to be used as one after the other. They are interwoven as we are practicing and their needs come up, we keep using them. We don't say, okay, I have to do attending first before I do reflecting, before I do empathy. No, that's not the way it is. And that's why we are learning them now. So that as the process go on, we'll be able to pick as each one comes and be able to interweave it together to be able to help the individual. And that is what makes it one to do it as an expert and not just somebody who is just trying to be like a picky eater. That can become problematic for the person who brought the meal for us and the patient in this case is the one who brought their problem for us to see. So ability to practice them interwovenly is very vital, and that's why supervision will help the individual to be able to develop this. And we should be able to integrate these skills to create a collaboration with the client, and we should do it in a supportive way that the individual felt cared for, which I call the TLC, the tender loving care, is brought into the therapeutic relationship, because this will help to facilitate the positive client outcome. And we should not forget the cultural sensitivity of all this. So having talked about those basic or the core skills there are also some common intervention techniques that are used in counseling practices, and these are some of them. We can advocate for a life change for the individual because they are very important. Because to do counseling, and if there's a need for a lifestyle change, and without emphasizing on that, and then there can be trouble. And this usually have to do with habits. Some people have some bad habits they form, or some disordered habits, or an habit that is bringing pain and suffering for them. We have to let them know that they need to modify it, and this can go as high as to change their lifestyle generally. Then we can help them know that there's no harm in seeking help from others, and where to look for resources to better to get well. And this, we can challenge it by asking them, because some people might feel that no, I don't need to ask for assistance from others. This type of asking for assistance is not about the individual being a beggar, but for them to look at the intangible thing they are looking for. It's not monetary in this case, but those intangible things will go a long way to help them to get well, because they are going to be part of those things that what we call the family role, or what we call the supportive drug, the social support drug that individual might take, but they are intangible and the individual might not see it. So seeking for help is not a sign of weakness; it is a sign of somebody who is strong and willing to go the extra mile. And they say if you go alone, you don't go far, and you get tired. But if you go alone, if you go with others, you may go slow, but you go far. So that is very important for them to be able to appreciate that. And help them build their self-esteem is very important, and this can be through self-affirmations and other skills that may come through there. So self-esteem building is very important, because with people without the self-esteem in the right way, not inferiority complex, not superiority complex, but to have the right self-esteem that help them to know, oh, this is something that happens to everybody, which is normalization. And knowing that that doesn't mean I'm weak, that doesn't mean I'm disordered. I mean, deficit as a woman being compared to other people. It means it can happen to anybody, and from that way, I can ask for help, I can grow, and so the self-esteem will build up. Teaching relaxation exercise is also very important. From the most simplest, which is deep breathing, doing it the right way, to the most complex, which can include body scanning and other mindfulness and all other exercise in that ring. When people have hobbies, they can also play a role, especially it helps to do some aspects of behavioral activation. So asking people to have healthy habits will be very helpful in that. Spending time with loved ones is also very good, because it helps one to be able to have people to share with. It help limit the isolation that people may be having, and the mental loneliness that people may have that nobody cares. It helps to erase that, because people will be available and they will performing function for the individual. Spirituality is another aspect that one of the practice that has been done. Of course, in the scientific form, it may look like helping somebody to improve the hope of the individual, helping them to improve their wisdom, to become wiser in the process. Where it's this our all commonality as human being, and this can happen to anybody. Helping them to have good reflections. So spirituality can look that in the scientific realm, but it can go deeper than that. But you should be able to know that it's distinct from religiosity, mere religiosity, not just to do religious, but the religiosity should be able to earn the individual some quality of what is practicing, and that will be valued in terms of religiosity and in terms of spirituality, and that will give them they provide a good sense of meaning and purpose in life, and that will bring comfort that they need and yearn for. Skills training are also very important, from hard skills for those that don't have it, or rehabilitate them to get back their hard skills, to soft skills for those that did not have it, for that they need it for day-to-day interaction, and be able to build rapport to work as a team. So those skills are very important to teach the individual. And so because one of those things that raised problem solving skills, how they can identify what the problem is, how to brainstorm looking for solutions to those problems, how to pick one and try, they are very important because they are part of skills training. And facing and learning from one's failure is very important. Helping people to know that my role is not just to run away from this problem. Yes, I'm of the problem, but if I don't learn from it, when other problems, similar or not similar, I will still not be able to overcome them. So that is helping the individual to learn, to face and learn from failures that might have happened before. Perseverance, to push on, to persist with determination is very important. And this might be close to the concept called grit, which shows that people who are gritty, they don't give up. So and that helps because it helps people to be able to value that uh, persisting with determination will get them to where they want to go to. It's not just for them to just feel that I'm strong, but the growth mindset will be activated and they'll keep moving that yes, this can be solved and I can move forward. They will not develop fixed mindset and the perseverance work there. Goal setting is very vital. How to set goals and how to do it, we may look at it soon because it's very important. Without setting goals in counseling, it will be difficult to help the individual to overcome those surface problems that you are trying to help them with. Positive reframing is very good. I didn't call it cognitive restructuring because they are two different things. Cognitive restructuring, they have techniques, skills, and depth of how to do it in CBT, cognitive behavioral therapy. But we can help people to reframe their thoughts to a positive ones. And that is very important because we are not going through the depth of to do a cognitive structure, which takes time and energy to do that in order to identify some of those deep-seated negative cognitions or maladaptive cognition. It takes long to be able to get them before we can restructure them. But for positive brain, that is easier and we can all practice it. Maybe at most, that's what most of us do and we call cognitive restructuring. We can teach people to practice gratitude, and that can involve listing, doing gratitude journaling or gratitude recording of their. They have their phone, they can press the record and mention three things they are grateful for the day and stop it, and they can play it over and over to see it, reflect over it. So gratitude practice is also very important. Social support, I can't overemphasize that, are very important. That we should learn to be able to help the people to say who are the people that are helpful by drawing their support cycle. That you are in the circle. Who are the people within the circle? People that should be in the circle. People who are actually helpful. They are present and they are helpful. They are not people who are present but they are not helpful. They will be on the line of the circle, outside the circle. So getting this is very important for any that to be able to appreciate people to lean upon that can help them to get through the stormy weather. Affirmations have been of talked about before in the above we talk about self-esteem is this self-affirmation, and self-compassion is very very important. To show self-kindness to ourselves is not the same thing as narcissism. It's not the malignant self-love that people may have that make them to be narcissistic and be able we will not be deriving causing problem for others in order just to say I want to feel happy. If I don't feel happy the others should not feel happy, then that is troubling. But self kindness is not about that. It's about learning how to forgive ourselves where we have erred in order to move on and be able to do better and help others. So self compassion is very good. So how do we set goals? Because this is one of the core skills, one of the core things we'll be doing in counseling. And that's why our goal should be SMART, which is it should be specific and measurable, it should be achievable and realistic, it should be relevant and meaningful and time bound. But I've tried to show us this template which we can use in our therapy. When we go, we can draw that. Look, what is the specific goal that this individual needs to achieve? We can have more than one goals. We can list many goals. Then we can now make hierarchy of them and list them. So they are specific. They are not just lumped together. Oh, I'll be failing exam repeatedly. So why do you fail exam? Or I don't read. So what should you do now? I have to read. That's a specific goal. I want to read. So okay, how will you be able to read? Oh, I have to get a discussion group. That's another goal. So you it's about that, and you're making specific so that it goes. Then it must also be measurable. And this will be very important because if you can't measure, you can't know whether we're making progress or not. And because from the specific goal we set, right from the time we identify, we can know where are we and where do you want to get to from it. Then we want to look, is it achievable? Yes. How do you want to achieve it? Like I said, the spending want to pass exam, want to read more. You need a support, you need a support group who reads, you need maybe to join a reading club. And so those are that yes, it's achievable, and this is what it needs to do. So we're able to help them ensure that they go that no, this is realistic, this solution is realistic, and then this one can be taken. Then we can look at it. How relevant is it? That the solution that is suggested, does it align with the goal? Does it meet the client's broader objectives and the long-term objectives that will be set, which are part of the goal? And how long should it take for the individual to get it? That timeline for me is there. So, and there are specific application. I've tried to also give the what it may look like so that when we get the slide, we take and look at it. That's specific. I want to improve my ability to manage stress at work. How should you be look at? What specific area of your life do you want to improve? So that will help us to get the goal right. So we have specific goals. One, I want to improve this area of my life. So that is the goal. For the measurable, I will track my stress level using a journal and rate them on a scale of 1 to 10 daily. Fine. Every day you do that. How will you know you are making progress? So what tools or indicators that will be used? That will help us to measure it. So we either a visual analog scale or we get some other sophisticated scales and things like that for the person to use so that we can measure it and we know for each day this person is improving or not. The person can feel that and we can be able to look at over time whether there is progress being made or not. So that's what this is about, and that's why this template will help us if we want to practice as a uh, counselor, and when we set goals, to see that that goal will be achievable, relevant, and there will be time. So, what are the common issues or conditions that some of those interventions I've talked about? How can they use this? You know, one of the most common conditions in Nigeria are anxiety and depression. And anxiety disorders are so much based on the work of Professor Gurije, Professor Dofer, Professor uh, Wakwe, and the rest, that they find that the prevalence of anxiety in Nigeria is about 5.7%, while depression range from 3.1 to about 7%. So, and all these are there. So people who might have mild anxiety or mild depressive disorder might comes to us. So we are not diagnosing the anxiety or depression. We are trying to look at some of the surface symptoms or surface problem they have and what can we help them to go. So when we are doing counseling, we can talk about life changes for them. For those with depression, what can they change now? What is not changing now? What can they change in the future? How can they go about changing what they can change now and what they cannot do, what they can do about what they cannot change? How did they manage what they would think about? And things like that can be taught to them to help them cope better. And then we start reducing the some of the surface pain they're having, hoping that over time, maybe that might even affect their deeper level issues. Teaching relaxation might also be helpful for people with anxiety. Some spirituality practices and other skill training might be helpful in that. This also go through to relationship issue, people going through trauma, grief and loss, stress management, life transition issues, self-esteem building, people with substance use disorder. Some of these, all these skills can have application in all of them. So it is due to our own creativity, our own practice, and working under supervision. We ensure that we use them. Our supervisor will go, you use it well, you did not use it right. You have misinterpreted it, you have misapplied it. So that all that will take place and be helpful for the individual who is practicing counseling. Ethical considerations in counseling. We are not new to ethics. So I'm just trying to just list us that the common ethical principles were usually taught with autonomy, respect for the rights of the client, beneficence. It must be for the good, the best interest of the client, to promote them, not to harm them. Non-maleficence is not to harm them. Justice, to see that it is fair and equitable. Fidelity, we are bringing trust and integrity to this, and we are staying true to it. Confidentiality, we are going to protect all the information here to see that we don't abuse it. and with so that because by abusing it can lead to harm. But we can also let them know there may be time which you might look at the other decision that those confidentiality might be breaking. Informed consent should be obtained before initiating any intervention. Professional boundaries must be obtained. They are not typically put in ethical principle, but as a counselor, those are part of your ethical guideline. You must maintain the professional boundaries. What are the do's and don'ts that this is allowed and not allowed in the therapeutic relationship is very vital for all of us that are here. I want to believe the profession we belong to have the ethics that guide it, and we should familiarize ourselves with it because we will find one thing ethics first before we face some other legal litigation. We should also try to build cultural competency and cultural attunement as we grow in this because it will help us to be able to assess and help most of the clients that will be seeing. Supervision and consultation are essential. You cannot be doing counseling or psychotherapy without going through supervision and without continuing supervision. Supervision is for the life of the practice, and this will continue and it will be carried out in different modalities. Self care is part of the ethical principle. It's not mentioned there, but it's very vital that we should remember that we hold to ourselves. Because when we are well, we'll be able now to be able to help others. But when we are sick, we'll not be able to help others. And continuing professional development, continue education. And like I said, these are just introduction to what counseling is. And that's why continued professional development will help us to see that, oh, we keep developing our skills and what is expected of us as far as counseling is concerned. So these are some of the few places I'm saying that I've made a note on the ethical consideration. In terms of confidentiality, there might be times that might be breached because it has limit. And when there is child abuse, imminent danger to the person, then that might be breach because we want to save life or want to rescue somebody who is going through trouble. And if this is not spelled out when we in the initiation phase, in the initial stage of the then we can be find trouble wanted there. And that's why it's good to spell those things out. Informed consent are good, but we should be able to tell them all that it takes. What are the goals that we're going to, the method we're applying, the fee for service that is going to be rendered, and the limit of the confidential. So all this should be there in the informed consent the person will sign, and it's vital that they should do that. And it's informed consent will take place, and it's an ongoing process all through the process, all through the counseling time. Professional boundaries must be maintained, and that is why those boundaries are very essential, because whatever goes wrong during counseling or psychotherapy, the peers will hold the person responsible first before other judge will judge. Then cultural competence and attunement are very important, and we should look what are the implications of this in our practice. Because well, if you don't appreciate all this and are able to integrate them together, we are going to face a lot of ethical dilemma. Then we will not know that we need supervision. We just think we can do all this on our own. And without ongoing professional development, we will start harming the patient with the intention of trying to help the patient. And this is very important that we should look at it. So how do we take care of ourselves? These are some of the self-care strategies to do. Stress management technique, maintaining healthy boundaries, seeking support, prioritizing physical and mental health. Supervision are very important. They are one of the way we take care of ourselves because our supervisor can look at emotional issues that might crop up from the counseling process, and they'll be able to provide ways to handle it. And by focusing on the supervision, they'll focus on and be able to help you navigate and overcome this to see that ethical standard and move forward. Continuing education are essential. So, in summary, what I've just tried to talk about today, and this is my summary slide, it's also crowded. My apology for that. That in summary, that I've tried to tell us that counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish well-being. Theoretical framing depends on the counselor's theory of specific psychological skills, but there are some that may seem to be very helpful for the person, like the psychosocial theory that I brought forward, the the psychosocial theory, and also the grief stages. They're important because most of the people we meet might have one thing or the other. They will be at one stage in this and be able to help them to navigate that. But other theories will also be very helpful to know. But we start where we are And as we grow in that, then we can add others to it. The therapeutic medium is usually understood that we help the client that to live the life they want to live. And this will be helpful by transforming their problems for them. That's the psychological confusion they brought into the therapy to clarity. Once we can be able to achieve it, then it helps us to learn that, oh, we have helped them to be able to overcome that surface level problem they might have come it. It might be self doubt, to get more self awareness, to get more self esteem, and things like that can be able to do that. And once we can get it, the individual will be able to know, oh, I've improved, and this will be through the person, or they can take control of their life again. They have achieved the desired goal of what they do, and they can restore themselves back to where they felt they are functioning before the occurrence of the crisis. In counseling, we have a way to know what is normal or abnormal, and that's what the psychology, the theoretical foundation that we started with, help us to know that, because it helps us to know this is what is normal, what is abnormal. Those theory, foundational theory, are very helpful. And by knowing that, we know what is problem and know this is solution. We know how to deal with it. But in counseling, the emphasis is not on psychopathology, not on those depth disorders that we're doing. It's trying to look at what are surface level problem and what we can do it. The therapists, for them to be very effective, they must be non judgmental, learn how to practice attentiveness and rapport, active and empathic listening, effective questioning styles, focusing and challenging, reflecting on the counseling process. And this is one of the areas that I've put last. That's why I mentioned it, that it's worth mentioning. Transference and counter transference will always be part and parcel of all our clinical encounter. It's not only during counseling or during psychotherapy that we get it, all our clinical encounters. And it will also point to us why some patients might prefer certain type of therapies or otherwise, when it has been proven that the two therapies can provide similar thing the similar way, but some patients may prefer one than the other. Transference might be an issue there. And if you are the one seeing such patient and you cannot handle the transference, then there can be challenge where the patient is trying to bring back what happened in the childhood and trying to project it onto the personality of the therapist or the counselor that he or she is facing, either in a positive way or in a negative way. Counter transference will come from the therapist, and this I've shown to. There are times we as therapists we are more in tune to help one client or patient. We attend better to one client or patient compared to another. And this counter transference or what we too have experienced in childhood, where it's also take place in therapeutic relationship and make us to overdo, cross the boundary to offer what we need to do to help this person, and we are not going to extra mile for the other. So that is very important to be able to appreciate this, so that, because if we cannot balance this, then it become problem then. And it can also be one of the things that people might cross boundaries at times. And we should remember, when we do counseling or psychotherapy, we work at the appropriate pace of the client or the patient. And there's some obstacles to be able to successfully do counseling. Yes, when the counselor is not motivated for the session, then that's a big challenge. But that's on the counselor. But on the counselor part, the counselor too might lack motivation to do what they want to do because of problem with creativity. They are not able to deal with their own prejudice against the client. That's a cultural problems, issues there. They have some preconception about the issue faced by the client. That's also being judgmental before they come into the process, and they are not able to resolve it. They feel social distance between themselves and the client, and that may be counter transference playing some role there. And they also may feel insecure or lack self-confidence because they've not been able to practice under supervision to build that confidence and to be able to overcome that insecurity that they have. And that does affect what they are facing. It's different from when a practitioner is being bullied by a senior. When the senior are bullying the younger one, that's not supervision. The supervision is a trusting relationship that are called there. And when the counselor is impulsive to clients' comments. And that is why learning those skills of empathic listening, silencing, they are very important. We don't try to interject. We don't, or else we miss out the information from the expert of that, and that is the patient who is the expert in his own suffering. Thank you very much for your patience with me, and thank you for the hiccups that occur along the way. And we'll go to back to Prof and to the discussion segment. Thank you very much.
Thank you very much, Dr. Abiola, for the lecture. I'm sure if you look at yeah, thank you very much, Dr. Abiola, for the lecture.
Thank you, sir.
And if you look well, you'll see a few people saying thank you the digital way.
I'm
It may
grateful.
not be as rewarding, but that's all we can have. I don't know if we have a few minutes of discussion. And if there are any questions, please write the questions in the chat sections. If you don't want to write, you can raise your hand, and if no other person's hand is up, you can ask the question verbally. So let's have the questions. You either write it down or you can ask. So we have a few minutes to do that.
Thank you, everyone. Thank you, Prof.
Is anybody asking a question, raising your hand and asking a question? Or if you prefer, type it out.
Prof, I think there's a question in the comment area. That's in the chat. There's a question in the chat area, sir.
Please, I don't know. I'm not able to see many things today. Can you read out, please? Sir, can anybody read out the question, please? Dr. Biola, you can read it out. Though you are the one to answer, you can still read it out because I'm not
I'm sure it's
looking. I don't know
possible
what.
for everybody here today. It's like a discussion question. The question is that with the very needs of clients, will you recommend focusing on counseling training for non-professionals in mental health promotion in order to better utilize the expertise of the professional to handle more complex cases?
I don't think you. I don't think Dr. Biola. I don't think you should answer that. So let's have any other. How do I put it? Some other person should answer. I don't think it's such a general and important thing that we should actually not even an answer. I think we should spend a minute or two discussing it. It's too important to just take an answer. Can we have a discussion on it? I wish the person, yeah, is anybody who has a comment on it? Let's welcome comments, maybe one minute from 2, 3 people. I think that's too important to just have one person. Please, anybody who wants to make a comment on it should unmute himself or herself and then give us a less than 1 minute comment on it. Then other people will be able to do that too. Maybe we'll take 2, 3 people. Or nobody wants to say anything about it. Well, since nobody wants to talk about it, that's interesting.
So maybe if I may ask, there are many non-professional in the health sector. So I don't know whether if there is a way uh, to delineate who specifically or the range of whom they are. Maybe this may be helpful or may add something to the answer of the question. Because for non-professional in the mental health, I don't know, could the non-professional be referring to maybe uh, an accountant working in the health sector, or a chaplain that works in the health sector, or uh, or maybe the hospital attendant. So, or we look at those other healthcare workers like the CHILs, the community extension health workers. So I'm just trying to make sense of, because if you understand whom the non-professionals, I'm sure we may have more comment on this. Maybe if you mean by professionals, I would referring mainly uh, to the psychiatrists, the nurses, the mental health nurses, the clinical psychologists, the medical social worker. This is also a good, because if you have an understanding of what this, because and that's why it's a good thing for the discussion, and I'm sure everybody have an opinion. So please, Prof, I say please, we should all try to make comments. I'm still booting myself, try to make sense of it. Thank you very much.
No, I don't think it's a very specialized kind of thing. I think there are people. I think the person is asking whether people who are not professional or professionally trained can do counseling. I think that's the question. Many preachers, Christians or Muslims, many people who are heads of departments, whether they're in medicine or not, many people who are in charge of a group would be faced with problems and they have to solve with members of that group. I think this sort of thing. A teacher is in class, he has never done anything. One of the students comes late and is crying at the end of the class. The teacher, whether he's trained or not, will be stuck with the patient, with the student. So these are the kind of situations. Does one need to be specially trained? Must someone be a trained counselor to be able to counsel? I think that being a trained counselor helps. But if one is not available, what do you do? Shy away from helping resolve problems from someone because you are not trained? I think that's how I look at it. Not answering your question, but Dr. Biola was trying to find out the scope of what you mean by the person means by non-professionals. And non-professionals are in situations to offer help or are expected to. Take someone who is a carpenter in his shop and one of his apprentices comes there crying and things. He'll be forced to step up and do something about it. So I think we should open up the meaning of professionals to mean everything. Must someone be fully trained to counsel another? I think that's the question.
Yes, sir. Thank you, sir. Dr. Kisley will raise up his hand. Sir.
Okay.
Sorry, this is not so easy for me to navigate since I'm not so used to it. But I think you can hear me now.
Yes, please do.
All right. So thank you very much for your very interesting presentation. And thank you, Prof, for moderating everything. Is needed. So now to go straight to the question that is being asked, do we think that we should train non-professionals? Well, like Prof was saying, non-professionals, all the ones that Dr. Abela were talking about, I think they're professionals in their own right because they are trained professionals in the healthcare arena, especially mental healthcare arena. And one way or the other, everybody provides some form of counseling. But how dare, because no matter how we try, we can never at any time have enough mental health specialists. Even in the most advanced countries, they don't. So, like Prof was saying, people provide what they believe to be counseling in their own different life issues or in their own different life endeavors and all that. And some of them do more harm than good while at it. So I think that if we can make the issue of counseling, people having basic counseling knowledge in such a way that we open it up to be able to train people in their different spheres of life, because either we train them or not, they will continue to do what they think is counseling, which will really not be counseling and they can do more damage. It's like when you talk about basic life support, resuscitation, and all that. Everybody is supposed to know. Either you are a doctor or you are not a doctor, you are a carpenter or whatever. That's what I think that should be the attitude to this counseling. And you know what is interesting to me from some of the things I've done is that when we are the one that train them like that, we can now open them to ethical practices for them to know their limitations. They get connected to us and they refer patients to you in the appropriate way. But when we don't, then they will do the that doing, they will become arrogant and so I think that we should open things up as possible in basic counseling, whereby the things that of course they cannot do and refer to the appropriate professionals, because ability to recognize your limitation is also very important. Some people don't have it, but when we are the one providing this training for people, they'll be able to have the basic counseling and then know the limit and know when to refer. That is my contribution to this discussion.
Thank you, Professor Kingsley. Thank you, Prof. I agree with you. Maybe one of the places that I didn't emphasize upon is that to show that there's other similar things that look like psychotherapy, similar things like advice, coaching, mentoring, and those other fanciful things that people are bringing up these days that people might try to equate them to counseling and psychotherapy or psychoeducation. And that's also why when our elders, Professor Oeri, Professor, and all of them, that they say that they insist that it's good that we have a foundation first. And thank you, because this is what is bringing this up. Because without this foundation, there will be a lot of assumption that people might claim that they are doing counseling maybe as a teacher, as a lecturer. At best, what they are doing is just giving advice, because what they are doing is just a one-way thing. Advice is good. Some advisors are paid better than mental health professionals. They are paid better than counselors. I mean, they're all psychotherapists. Yes, and giving advice is good, but what it takes to give the right advice is troubling. But in terms of people that are having this basic level problem, the superficial problem that we need is advice will not help them, because the person giving did not even understand what the problem is. He might just think that because the person cried, he just say sorry, that is enough. But and thank you, and that is what I think this brought up. That's trying to bring that the non-professional in the mental, anybody not in the mental sphere, that is more clearer to me. And the person that asked the question, I thank her, Dr. Ayatude. Uh, it is helpful for us to be able to see the wide variety of this, which means that it's also, it will take a lot of effort too to be able to train them to move to the level that we want, because it is when they have this that will help us. I know most schools, especially university, they have the guidance and counseling unit, but we still doubt what exactly take place there. Most of when people go there, what they just do is they give advice. They don't provide what we expected, because they are not assessing what might be the trouble, what might be even that superficial problem, what it is. They are not assessing that. They are just afraid, oh, you can do it. You go, which is maybe one of the skills that they are providing affirmation. But that is not enough. That they are doing that. They should be able to know what are they providing information for, the goals they set, is the goal being achieved, is there need for follow up? All those are missing, which I agree. Fine, with enough capacity, uh, then we should be able to see how we can focus on this and see providing at least basic counseling skill, but go a long way and be vital to help people in this area. That's the few I can say about that. But I'm sure many more people are still here, and they'll be able to provide more insights and more comments on this. Thank you very much.
Yeah, thank you very much, Dr. Abiola. Is there any other comment on that, or we take another question? Is there any other question written down in the group, sir?
No, sir.
None. Okay. All right.
So I think the person later clarified that it's about teachers, managers, bosses, lecturers. Yes, they definitely need counseling skills. That's what the person later clarified.
Okay. Yeah. Yeah. That, I understand that. Okay. That's
Bosses.
good. Okay. And I think we answered the questions properly because we included all those in the examples and the comments that we made.
Thank you, sir.
No other question written down. None.
None, sir.
And no other person raising hands to ask a question. Chair, I assume that would have the lecture also on the chat group.
Yes,
I wonder how we'd do if someone is joining the chat group today. He won't see the one that was done last time, right?
that's true, sir. I will,
Anyway, if someone is yes,
I will have to repost all of them.
all right. I think that's probably that what would happen. Maybe every time we have a new person, I don't know, because it would help.
That's true.
Yeah. So we would post the lecture like we did last time, and the idea is for the discussions to be on during the week. I don't think we had any serious discussions beyond the first day or two last time, but I'm hoping that with this time there'll be more people asking questions or making comments so that we can have a healthy discussion, because most of the training, I assume, would take place, most of the understanding and digestion of the lectures would take place maybe a day or two after the lecture itself. So, gentlemen, ladies, let's check back at the chat group. If there are any persons who want to join the chat group, it's still open, as I'm sure. So before the week runs out, would forward the application forms so that everybody can fill certain basic information about himself, so that it would help in the administration of things. So I think that's just the basic information. Dr. Biola, I don't know if you have any other information you want to add, please.
And thank you, sir. There's also a link that was sent there. Please, we implore all of us to help us fill it, because it will help us with this next the other half of this lecture, which is psychoeducation. Because knowing where people are will help us to know the emphasis to put and where to move forward to. Thank you very much. Yes, sir. Thank you, Prof.
All right. Thank you. Thanks. Okay. Well, we've just done, we're 16 minutes late. We're supposed to finish around noon. So I thank all of us for showing up. The class has dropped by 50%. I wonder why. Maybe we should remind people so that the people registered or people who are signed up for the courses should be present. I'll also mention one or two to people. So let's try and remind other people who we think should need some basic training. And